capsule and ligaments. Capsule and ligaments. Suppose if you see this is a synovial joint, synovial joint will be having capsule and ligaments. So if you see the capsule which is going to present between the two atlas surfaces from superior and so this is a joint capsule. This full joint capsule. It is a like one covering layer. It is going to cover the entire joint. So the capsule which is 2 times bigger. It is 2 times bigger than the head of humerus. It is 2 times bigger than the head of the humerus. Suppose if we take this head of the humerus and this is the glenoid cavity, the capsule will be going to surround like this completely. It is going to cover the joint. This is the capsule. Okay. So now this is 2 times bigger than the head of the humerus, and at the same time superiorly the capsule is very tight, and inferiorly and anteriorly it is little loose. It is anteriorly and inferiorly the capsule is little loose. Superiorly it is very tight because of the tight and because of this tight orientation or because of this tightness. When the arm is in resting position is, suppose if one person is standing, the limb will be complete upper limb will be like downward. It is very free. So because of the tight superior capsule which is present here, the entire shoulder joint will be in stable position. And one more point. Suppose if we do abduction plus external rotation of the shoulder. So abduction plus external rotation. See, abduction and external rotation of the shoulder. What will happen means, in this abduction external rotation, the synovial, the capsule which is present here, it is going to fold itself. Here it will fold when if we do abduction. See, abduction away from the body and external rotation. If we will do these two movements, that time the capsule which is present here, it will fold itself. Then it is not going to allow further movement in the shoulder joint. That is nothing but the closed pack position of the shoulder. That is nothing but closed pack position of the shoulder. What is this means? There is no further movement is going to be happen once the shoulder is reached the closed pack position. And one more point. What is open pack position? Open pack nothing but loose pack position. Loose pack position. In this position, suppose if you see this is the resting position. Here there is some space between the two atlas surfaces. So if I hold humerus, if I do like this, distraction, the head of the humerus can move 2.5 centimeter, otherwise 1 inch away from the glenoid cavity, so that here when the joint is in loose pack position, the distraction can be possible up to 2.5 centimeter or 1 inch. When the joint is in closed pack position, there is no further movement is going to happen. What is the closed pack position for the shoulder joint? Abduction plus external rotation or lateral rotation. This is the closed pack position for the shoulder joint. And one more point, the capsule is less stable without involvement of the ligaments. So that here the need is coming, that here the capsule is little loose in the inferior anterior portions, and it is very tight in the superior portion. Even though capsule is like this, still the capsule is going to provide the less stability without involvement of the ligaments. If the capsule is going to provide the more stability, it may require reinforcement. Nothing but the assistance or support from the ligaments, so that the ligaments plus capsule together can provide the better stability to the shoulder joint. Now we will see the ligaments of the glenohumeral joint. So the capsule of the glenohumeral joint is reinforced by the two ligaments, only two ligaments. That ligament, the first ligament is coracohumeral ligament. This is one, and second one is the glenohumeral ligament. Now first we will see what is this coracohumeral ligament. The coracohumeral ligament, which is going to present between the coracoid process of the scapula to the humeral head. Suppose here this is the coracoid process. No, from here the base of the coracoid, from here the ligament will be up to the humerus. This is the coracohumeral ligament. If we see glenohumeral ligament, here in this glenohumeral ligament we will be having superior glenohumeral ligament, inferior glenohumeral ligament, middle glenohumeral ligament. So we will see one by one. This is the superior glenohumeral ligament. This is the middle glenohumeral ligament. This is the inferior glenohumeral ligament. Superior, middle and inferior glenohumeral. These three ligaments together we can say like glenohumeral ligaments, also called as capsular ligaments, because these are going to these are going to give assistance to the capsule of the joint. So these are the ligaments which are present here. Now we will see one point about one ligament. First one, coracohumeral ligament. This ligament will be having two fibers. This ligament will be having two fibers or bands. Two fibers or bands. The ligament is going to start from the coracoid process. The ligament is going to start from the, this is the coracoid process, this is acromion. Ligament is going to start from the coracoid process and it has two bands. The first here, the first band, and this is the second band. The first band which is going to insert over, it is going to insert over the greater tuberosity of the humerus, greater tuberosity of the humerus, and the second band. And if we take the second band of the coracohumeral ligament, it is going to insert over the lesser tuberosity of the humerus, So the greater tuberosity here, one near to greater tuberosity, one muscle will insert. What is that muscle? Supraspinatus muscle will insert. And here lesser trochanter, one muscle will insert. What is that muscle? Subscapularis muscle will insert. Subscapularis muscle will insert. So here the point is the ligament, coracohumeral ligament, which is going to start from the coracoid process. It has two bands. One band it is going to insert to the greater tuberosity, where exactly supraspinatus muscle will insert, and one more band it is going to insert over the lesser trochanter, where the subscapularis muscle is going to insert. Because of the presence of these two coracohumeral ligament bands, they are going to create a tunnel. They are going to create a tunnel. From this tunnel will get the tendon, that is the long head of the biceps tendon. Will get through the tunnel formed by the two bands of the coracohumeral ligament. Now, one more point here. If you see glenohumeral ligament, we discussed that, but we didn't discuss what is the main function. So here, whatever the ligament, it has to provide the stability. It has to provide the stability to the joint. So what kind of stability this ligament is going to provide means it is going to resist. It is going to resist or control. The inferior translation, inferior movement of the head of humerus. What it means? Suppose clavicle is fixed. If somebody is holding the humerus, if they are pulling it downward, so that time the ligament which is present here, it is going to stop the downward pull of the humerus. That is the function of this ligament. And some authors they are saying that it is going to stop the superior movement also. Stop means you have to understand, like, it is not going to stop. How means, suppose I told here somebody will hold and they will pull. So when they are pulling, that time the fibers which are present here, it will stretch so that the humerus will not go further downward. That's how it is going to resist or control the downward pull. If you see superior, some authors are saying that it is going to provide the stability in the superior also. So suppose if somebody is holding and they are like pushing like this, they are doing like this, humerus has to move upward. When it is going upward, so that time the fibers which are present here, the ligament fibers, it will going to stretch and it is going to stop the further superior movement of the humerus. This is the function of the coracohumeral ligament. Now we'll see glenohumeral ligaments. Now we'll see the superior glenohumeral ligament. The superior glenohumeral ligament, which is going to start from the superior glenoid fossa and coracoid process, from the superior glenoid fossa and coracoid process, and it is going to attach to the head of the humerus. Okay. Now what is the function of this one? So before going to function, the ligament which is present here, one author he discovered that he identified that. One author he identified that the ligament which is present here, superior glenohumeral ligament, it is going to take the connection from the, not connection, this ligament, see, superior glenohumeral ligament plus here superior joint capsule plus coracohumeral ligament. The ligament which is present, this is coracohumeral ligament. These three structures, see, imagine here, suppose this is the joint capsule, just like to make you understand here I'm drawing. This is the joint capsule, superior joint capsule. Okay, so the three structures, superior joint capsule, coracohumeral ligament, superior glenohumeral ligament, these three structures are going to cover the entire superior portion of the head of the humerus, and at the same time these three structures are going to cover the supraspinatus tendon and subscapularis tendons. Here greater tuberosity will get the supraspinatus tendon, here lesser tuberosity will get the subscapularis tendon. So the fibers of the coracohumeral ligament, at the same time superior glenohumeral ligament and superior joint capsule, these three structures are going to cover the superior portion of the head of the humerus, that is one. At the same time, tendons of the supraspinatus, tendons of the subscapularis muscle. So the interaction of, or the coordinated activity of all these structures will call one name, will give one name to all these structures, that is the rotator interval capsule. Remember this name, rotator interval capsule. Remember this name. When we are going to see the stabilization of the shoulder, this is going to be a great nice point to understanding stability of the shoulder. So this is about the superior glenohumeral ligament. If we see inferior glenohumeral ligament. Inferior glenohumeral ligament. See, inferior glenohumeral ligament. The inferior glenohumeral ligament is it is a little big ligament in the shoulder. So here the inferior glenohumeral ligament will be having, see, will be having anterior fibers, anterior fibers, inferior fibers, and axillary fibers. Axillary fibers. So that anterior fibers will be there, inferior fibers will be there, and axillary fibers will be there. So because of the presence of these three variations, anterior fibers, inferior fibers, and axillary fibers, the inferior glenohumeral ligament is not, we will call like inferior glenohumeral ligament complex. Ligament complex, because of the presence of the three fibers of the ligament. And it is going to start from the inferior glenoid cavity, inferior glenoid fossa. So if we see, this is the inferior glenoid, this is the superior glenoid cavity. So from here, inferior glenoid, from here it will start ligament, and it is going to attach to the head of the humerus. And function of this ligament is, when the person is in resting position, there is no function of this ligament. Suppose when the person is doing 90-degree either flexion or abduction of the shoulder, if the person is doing movement either 90-degree flexion or abduction, from 90-degree, what is the normal flexion range? 0 to 180 degree. Normal abduction range of the shoulder 0 to 180 degree. So from 90 degree up to 180 degree of flexion or abduction, the inferior ligament complex, inferior glenohumeral ligament complex, which is present here, it is going to provide stability. It is going to provide stability to the shoulder joint inferiorly. So this is the function of the inferior glenohumeral ligament. Now we'll see last one, middle glenohumeral ligament. If you see the middle glenohumeral ligament, the ligament which is present here at the middle, otherwise between the superior glenohumeral ligament, inferior glenohumeral ligament, the ligament which is present between the superior glenohumeral ligament and inferior glenohumeral ligament, this is the middle glenohumeral ligament. It is going to provide the anterior stability to the shoulder joint, with the help of superior glenohumeral ligament plus inferior glenohumeral ligament. So this is how all the ligaments are going to reinforce the capsule. So that here capsule plus ligaments together are going to provide the stability to the shoulder joint. At the same time, mobility also will happen. Here, if we see shoulder joint, the special point is mobility is always more compared to the stability. Mobility will be more compared to the stability. Even though we have all these ligaments, capsule, still stability is less in the shoulder. How it will be less means we'll see in further classes, right?